Hi, my name is Max Hayes and I'm a tech analyst here at Edison. And I'm joined here today by Tim Barker, CEO of Kooth, and Sanjay Jawar, its CFO. Kooth is a leading digital mental healthcare company capitalised at £91 million and headquartered in the UK with a growing presence in the US. Tim and Sanjay, many thanks for joining me.
Hi, Max.
So to start with, for our audience who aren't too familiar with Kooth, can you provide an overview of the company and how your platform is addressing the growing mental healthcare challenge?
Certainly. So, look, poor mental health is a defining public health crisis of our time. Every year, 1 in 5 of the population has a diagnosable mental health need. And in addition to the impact it has on individuals, it has a huge impact on the economy. In the UK, it's about £118 billion a year. Globally, by the end of the decade, this is a $6 trillion problem. The problem is healthcare systems cannot keep up with the level of demand. In the UK, the NHS spends around £15.5 billion a year, every year on mental health support. That's growing at about 3% a year. But referrals for mental health care are going up 15% a year. Now, the only way you're going to tackle this challenge is to move from a mindset of treatment to one of prevention. And in the health market, that's really known as moving upstream. So you provide responsive, effective support rapidly to individuals at that moment where they first need support. So keeping people healthy as opposed to supporting them when they get ill. And that's what Kooth does. We were founded in 2001, over 21 years ago. And our focus is really as a B2B2C service. Our customers are the NHS, local authorities, governments, as well as corporates, to provide free at the point of use services to the population. Today, Kooth's freely available to over 16.7 million people in the UK, and we're making rapid progress in the US, which I'm sure we'll be talking more about.
Fantastic and very clear. And I guess, as you just said, you are expanding more into the US, particularly in FY22. Can you shed some light on the timing and reasoning behind this move?
Certainly. So we hired our first employee in the US 18 months ago. And I think the timing of that was fortuitous. Look, there's a growing recognition in the US that there is a crisis in youth mental health care. The statistics on it are incredibly concerning. 22% of teens in high school have seriously considered suicide. Over 40% of teenage girls feel constantly, isolated or persistently sad or hopeless. And so over the last year in 2022, we saw a huge step up in the recognition at both a federal and state level that urgent action is needed. Biden's first State of the Union addressed the need for a nationwide strategy on mental health. By June last year, they'd allocated $1 billion at federal level. By August, California announced a 5-year master plan to invest $4.7 billion in improving youth mental health. Pennsylvania announced a $160 million plan in October and contracted Kooth for a $3 million pilot to provide support to up to 150,000 school students. And even this year, in the last couple of months, New York, North Carolina have announced billion-dollar programs to improve mental health care. And the key to that is reducing and removing barriers for access. In the US today, if you need mental health support, you've got to, as a child, as a 15-year-old, you've got to tell your parents. They've got to contact your insurer. They've got to see if you're eligible. The barriers to getting support are overwhelming. And so with Kooth, the work that we're doing is about removing those barriers, just as we've done in the UK, to provide free mental health support with no thresholds, limits, or barriers, so that we can help people and give them support on their own terms.
Yeah, it's very clear why Kooth is so important for lowering those barriers to addressing those mental health care needs. And I guess what's been very impressive is that your share price has almost doubled year to date. And I think this has largely been driven by your impressive pilot project win in California. Can you elaborate on this development and what it means for Kooth?
Certainly. So, as I mentioned, in October, we went live with a $3 million contract in Pennsylvania. And over the last probably 9 or 10 months, we've been in discussions with the state of California as part of this master plan for kids' mental health. So we were fortunate enough to be awarded a contract. We're still finalising the terms of that, and we'll announce that to the market later in Q2. But this was a process where California has really spent a significant amount of effort understanding what the needs of youth are and experts to really come up with a view for what their vision is for mental health support through digital for 13 to 25-year-olds in our case. And look, we've been doing this for over 15 years, and I think there was just a really good meeting of minds that we already provide maybe 70% of what California is looking for. And now that we've been awarded a contract, we're now building out the remaining capabilities so that we can provide a service to go live in January next year. And I should say, this was a process where California vetted over 450 organizations. So there was an incredibly thorough selection process. And look, we're very humbled to have been selected as the provider. And there will be another provider announced for the 0 to 12 years, which is primarily more about family-based support. It's not what we do. And between the two of us, we'll be providing full support for ages 0 to 25 to over, for that 30 to 25 age group. That's a population of 6 million people that will have free access to mental health support in the new year. It's probably the world's most progressive, transformational mental health program right now.
And just to add to that, Max, you talked about the share price doubling. That'll certainly be on the back of Pennsylvania. And the announcement we made in respect of California, but whilst we can't give the full contract details just yet, it's just being finalised. We would then expect to be ahead of market expectations on revenue for 2023. The contract will go live in January of 24. I think the exact words we've used are that, this will be transformational in terms of our business. And again, just by way of comparison, in the UK, we currently cover around 9 million children and young people in that sort of 10 to 25-year-old age group. And California will be covering around 6 million in the 13 to 25-year-old age group, just to give you an indication of the scale of what we'll be tackling.
No, really interesting. And as you mentioned earlier, you said that funding is being rolled out across several states, and as you've only covered 2 states so far, clearly there is a lot of scope for growth. What is Kooth's plan to expand further in the US market? Could you share your growth strategy and expectations for the future?
Certainly. So, look, we couldn't be more delighted with the progress that we're making to date. And you're right, there are 48 other states to go after. There's just a fine balance here, though, because California is the most populous state, the largest state. So we really want to make sure we focus on execution there and a great go live in the new year. So I would caution for anyone thinking that there are just a steady stream of other contracts coming in between now and the end of the year. We've got to really focus on execution there. But, we have a sales team that are making sure that we are in conversations so that we can really demonstrate the potential that we've got to help transform mental health care. And clearly, on the back of Pennsylvania and California, our intention is to really focus on state level opportunities to support youth.
Great. And maybe looking more towards the financials, you reported some strong numbers for FY22. Could you talk a bit more about those results?
Yeah, absolutely. So look, we were really pleased with growth in 22. Revenue grew by 21% to £20.1 million, which was at the slightly higher end of market expectations. Of that 20.1 million, we started booking our first revenues from the US, around 1.5 million. The majority of that was the Pennsylvania contracts, but also a couple of smaller university accounts, as well as some initial revenues from California for some pilot studies, research and development work. We've also been really pleased with the quality of our revenue. 95% of our revenue comes from contracts that are 12 months or longer. And one other important metric for us is net revenue retention. And for us, this is very much our ability to expand existing clients. And I think when we've previously talked to you, Max, we've talked about our business model, where typically we might initially win a contract in the 10 to 18-year-old age group. And, you know, over the first sort of 12-month pilot project for a particular client, we will then look to increase usage of the contract through promotion work we might do in schools or in youth clubs or with GP surgeries, alongside maybe some social media work. So we're looking to increase the usage of that contract, as well as perhaps add an additional age group, maybe the 19 to 25-year-old age group, for example. So that, you know, for us is an important way of growing the business. And as I say, net revenue retention at 107% really reflects that. Excuse me. We were also very pleased with the growth in our Kooth adult products. 3 years ago, that was virtually zero. Numbers are still not huge, but we had 76% growth in ARR to £3 million last year. And Kooth adult now represents around 15% of our revenues. Gross margin remained quite close to 70%. It dropped slightly in the year as a result of the employer's national insurance social care levy. That was 1.25%. It was in place for about 9 months of last year. And we've also seen the end of the sort of final COVID projects that we've been working on. So, you know, we have no COVID revenues in the business anymore. A couple of final points. The balance sheet was strong, £10.5 million of net assets. And within that, there was £8.5 million of net cash. We don't have any debt on the balance sheet. We generated over 4 million from operations, and we've reinvested 3 million back into development of the platform. I would like that number to have perhaps been a little bit higher, but at the start of 2022, in the whole sort of return to work, great resignation debate, software engineers, development and product staff were perhaps a little bit more difficult to come by. But certainly in the last few months, we found it easier to hire people into those roles. And with the California work, I would expect our development spend to be a multiple of what it was last year. And finally, just a reminder that, you know, with the finalisation of California, we will expect revenues to be ahead of market expectations in the coming year.
Great, and I guess looking at your FY22 results, your UK business remains your core growth driver. So what factors have you seen that have contributed to the success, and have you encountered any challenges along the way?
Sure. So obviously, for our service for children and young people, we are the UK's largest provider for services for that 10 to 25 age group. And so with that, we continue to expand into new regions. For example, in Scotland, we made great progress last year. Again, a couple of years ago, we had no contracts there. We've now grown to 9 contracts. And as Sanjay mentioned, our service for adults has had a very good year from a standing start just a few years ago. In terms of the outlook looking forwards, as we know, the NHS, well, it's undergoing significant change, as well as challenges that are well reported in the media. In terms of changes, the NHS has reorganised around what's called integrated care systems. It's moved from 135 independent clinical commissioning groups in England to 42 ICSs. Now, when you organise the UK's largest employer, that's going to be a bit disruptive. So what we have seen short term is a slowdown in decision making, and that's as these regions merge, new people get appointed, care boards need to get decided, and strategies need to be defined. That said, for the long term, it's a great opportunity because of 3 things really. One, ICSs have real focus on what's called population health and early intervention, a focus on healthcare, not just illness. Also, a focus on tackling health inequity, so providing specific services that would help LGBT groups or ethnic minority groups, or for mental health, men, those that are less likely to use existing services. And of course, they also want to drive a transformation to improve efficiency through use of digital and data. So we see a long-term opportunity through the restructure of the NHS and a short-term headwind. we're starting to see the end of that, the sort of end of the start of that, as the NHS moves into the new year, as it did April 1. In terms of the strains that the NHS is under, obviously, post-pandemic, there is a care backlog. There's a lot of waiting lists to be cleared. And as I mentioned earlier, referrals into mental health services are going up 15% year on year. So as a service, we're able to then support people, whether they've got a low level of need or a high level of need, and do that in a very responsive way, hopefully keeping people off of waiting lists. But we've also started to get commissioned directly to prevent or reduce the number of people that end up showing up in A&E. So we've closed our first commission and rolled that out in London, where we are really focused on being the place to go to if you need mental health support. If you call 111 or go to your GP in Northwest London, they'll refer you to Kooth first. So we see that we have got a flexible service that can really adapt and support both short-term and reduce pressures off the NHS, and then enable them to fulfill their long-term vision for population health.
Tim and Sandra, really interesting conversation. You can definitely see the pressing need to have a platform like Kooth's to address the growing mental health challenge, and particularly by lowering those barriers to get the help that people need. And yeah, thank you very much for your time, and been a pleasure talking.
Thanks, Max.
Thanks very much, Max.
Bye.